This is a video documenting personal accounts of patient safety failures.
My sister, who's been in the hospital for a few days, was transferred to the intensive care unit today. Her doctor told us that her hemoglobin was really low and she needed a blood transfusion. I remember a few days ago, my sister told her nurse that she was dizzy and really extremely tired. She also got lightheaded each and every time she got out of bed. The nurse drew some blood work at that time, but we kind of forgot to ask about the results. My sister's doctor told us that he was never notified of the results either. When he reviewed my sister's chart today, he noticed that her hemoglobin was only 5, and we were told that that's extremely low. He seemed really upset that the nurse did not inform him of those results earlier.
Oh gosh, well I tell you what, I had my mom at the doctor a few months ago and he put her on this new heart pill and she has to get blood work done regularly to make sure that the levels are okay. Well, you know, a couple weeks ago we had dinner at our house and she came over and she insisted on cutting the vegetables. Yeah, that's fine. So she barely nicked her finger and it just would start bleeding like crazy. So we couldn't get to stop, not worth a darn, so we took her into the ER finally because, you know, we were nervous about it. And didn't they tell us she was on, you know, a blood thinner and that, you know, didn't we know about some of the different precautions and stuff? And we didn't know anything about it, you know, so, you know, they got everything maintained, they got her blood stopped, but thank gosh the nurses at the hospital went ahead and gave her information on precautions and what to watch for when you're on a blood thinner, and I think the name of it was Coumadin. So I wish they had, like, when she was at the doctor's, you know, if they had done that, like in the beginning, you know, we wouldn't have had to worry about it at this point. But yeah, she was just very thankful that the hospital went ahead and followed up with it.
Well, my brother had to go to the hospital. He had his appendix removed. They said he was really lucky it hadn't ever burst. Well, anyways, when he was in the hospital, the doctors would come in to check on his dressing. And I think maybe once or twice I saw some of them use some of that hand sanitizer, but they didn't really use a whole lot of it. And most of the time, I don't even think the nurses used it or washed their hands when they came in. But they said that now he has that MRSA. And so now when we go visit him, we have to wear a gown and gloves and everything when we go into the room. And actually, when I was thinking about it, the lady who was in the room next door to him, her family has to wear a gown and gloves when they go visit her too. So I was thinking maybe he got what she got, and I was thinking maybe the nurses and the doctors might have spread it.